Welcome to the Seeing is Believing Africa regional webinar. Thank you all for attending today. I know how busy everyone is, and I really appreciate you taking the time to join us. We have over 25 people registered from 10 countries across the region, which is fantastic. If you would like to introduce yourself to the group today, you can write your name and which country you are from on the chat box on the side panel. A big thank you to our webinar presenters, Glenda Mulenga, the Country Director from Sightsavers Zambia, Adolf Ollennu, the Programme Manager for Orbis Ghana, Kesi Naidoo, the HRD Manager Africa, Brian Holden, South Africa, and Sally Crook, Seeing is Believing Programme Manager, IAPB. The agenda for the webinar today will be firstly, welcome and housekeeping points from myself. Secondly, a brief introduction from Glenda on working with governments in the Africa region. Thirdly, presentations from Adolf and Kesi on how they work with governments in their Seeing is Believing projects. Fourthly, I will chair a question and answer session after the two presentations, because we do want the session to be nice and interactive. So for those of you that are attendees, then please do think of some questions during the presentations, and then you'll have the chance to ask them after the presentations. And then finally, Sally Crook, the Seeing is Believing Programme Manager for IPB, will make some concluding remarks. So the webinar will take around an hour in total. Firstly, some housekeeping points. I will share my screen and will show the PowerPoint presentations unless I give permission to the presenters, who then will share their own screens. But you should be able to view the computer screen through your GoToWebinar window to be taken through those PowerPoint presentations. Also, I've forwarded you the PowerPoint presentations in advance. Microphones are muted apart from the speakers, as this just ensures a better quality webinar. As I mentioned, we'll be doing a question and answer session at the end. So if you have any questions for the presenters, please type them in the chat box. And that chat box can be found on the right-hand panel of your screen. And you can post questions either during or after the presentations. My colleague Emma Foote is supporting us today with technical issues. So if you have any technical difficulties, for example with sound, you can send us a message in the chat box. Thank you, Emma, for your support today. It's a good idea to close down all other web applications, for example, Google, Outlook, Skype, to get a better quality of call. And if you have headphones, please use. And we realised yesterday, if you have a mobile phone close to your laptop, then it's also a good idea to put that slightly to the sides, because that might interfere with it. And I am recording this webinar and it will be uploaded onto the IPB website, and I'll send around the link in a few days. Finally, at the end of the webinar, I will be sending you a survey for your feedback. So, the theme of this Seeing is Believing webinar is working with governments, and the presentations today will explain how they've succeeded in engaging ministries of health and education at the national and provincial level in their projects, and in doing so have had a wide and sustainable impact. So I'm now pleased to introduce Glenda Mulenga, the Country Director from Sightsavers Zambia, to give an introduction to some of the challenges and opportunities of working with governments in the Africa region. So Glenda, I'm going to unmute your microphone now. Glenda, over to you.
Thank you very much, Susan. Good afternoon, everyone. So my task really very simple this afternoon. Just giving an overview, like Susan said, on working with governments. Seeing is Believing has been a big part of our work in the countries where we have been supporting eye health. Key to the success of the projects like Seeing is Believing are the partnerships we forge with national governments and the various levels of collaboration we have with other stakeholders, such as civil society. Working with governments is quite important from the onset if we're going to achieve key sustainability on the projects and contribute to improving national productivity. As we develop these projects in the countries, we have to ensure that from the onset, government through the ministries of health feel that they're the ones making the key decisions and also are ultimately accountable for the various project deliverables. When we talk of government and their expectations, it's important for us to think broadly of the many layers of government, from central, the region, up to the local levels, where we actually do our service delivery. As we work with government, it's also critical for us to respond to the priorities set out in the country national eye health strategic plans, as these provide a path and framework to guide the planning, the delivery, management, and implementation of quality eye health services in the various levels of government. Doing this is also quite important as it allows us to contribute to increasing eye health coverage across the different countries. So coming to challenges, I'm sure you're going to hear much more from the two presenters, but just as an overview, the first challenge I would like to talk about is the human resource in eye health. I'm sure you agree with me that in most instances, sometimes it's just that we don't have inadequate people working with us in implementing our eye health programs. Sometimes even when we have these people, we don't have control in terms of where they can stay. So sometimes they're transferred, even moved to other departments, not just across the different eye health programs. And sometimes it's just that we don't have the skills that we need to actually implement good quality programs as a result of this inadequate human resource for eye health. Another challenge I want to talk about is the dependency by government on projects. And this affects most of the delivery, especially if you're talking about outreach activities. When you talk about outreach, it's really important for us to reach people, vulnerable people such as women, children, the elderly, the disabled, because a static facility is going to exclude these people, due to things like culture, economic barriers, as well as gender. The other challenge I want to talk about is erratic supply of essential drugs at facilities where we work, as this makes it very difficult to provide regular services. And as you know, when we don't have regular services, this doesn't give a lot of confidence to the services that we are providing to the communities. Another challenge is the inadequate or poor, sometimes just poor infrastructure, such as maybe road network, hospital facilities, or just inadequate transport to get to and from the facilities where we are providing these services. In some countries, we also have a challenge of high service delivery costs, such as when you're talking about allowances pushing unit costs up. These allowances are money we pay to government staff that are actually providing some of the services when they move from one district to another or one region to another. I think this also is quite critical, as sometimes it undermines delivery of programs. Another challenge is maybe sometimes inadequate prioritization of eye health by government in the planning and the execution of wider health systems. When it comes to opportunities, I think one of the things I want to talk about is the fact that it's not all gloomy. There's really some really committed people within government and within the eye health sector. And it's important for us to really develop a personal relationship with these people and trying to nourish those relationships so that we're able to work well with them and we're able to know where we can get that support from. Integration of eye health is also quite important when we're talking about inadequate resources in the districts or the regions where we're working. So if you integrate eye health in other programs such as maybe TB, malaria, HIV, it really helps in terms of harnessing the opportunities and saving the little resources that we might have. In also some other instances, I talked about the National Eye Health Strategic Plan. I think that's also a very good opportunity, as it allows us to engage with government and also to hold them accountable. The presence of ministries such as maybe Ministry of Gender, as we have in Zambia, ministries responsible for people with disabilities, are also a good opportunity for us to engage, as we know that if we engage with them, it will allow us again to reach really people that are vulnerable and ensure that they're actually receiving a service. And I think another opportunity that we have on the projects is really to build capacity. We can build capacity at the different levels and ensure that even as the projects are coming to an end, there's some sustainability, especially at community level, where we know that if we've built some levels of capacity, even when the project has come to an end, we know that eye health workers on the ground will still be working. They'll still be doing some referrals from the community to the service providers, maybe at the district level. So that's what I had to share. Susan.
Thank you, Glenda. That was a lovely sort of overview about some of the opportunities and challenges of working with governments in the regions. I think that's really nicely sort of set us up for the two presentations we'll hear today from Adolf and Kesi. So we're now going to hear from Adolf Ollennu, the program manager from Orbis Ghana, and I'm going to make you, I'm just going to change presenter, right, so Adolf, I'm making you the presenter, and so Adolf is he'll share his screen, so you'll be able to see his screen through the go-to window, and then he'll be taking you through your presentation.
Hi, everyone.
Yep, Adolf, please, over to you.
So I'm going to, yes. Hi, everyone. So I'm going to share with you how Orbis Ghana has engaged with government last year. So this is just a brief overview of the project, which sort of gives talks who our key stakeholders are, and in government managing authorities, particularly Queen mothers, who are very key to reaching community members in the work that we do. So, working with government in Ghana, we adopted some key strategies and key approaches that we think will enhance our work and then ensure that what we do as make a maximum impact. So, though with the inception of the project, with the objectives and all other components laid out, we engaged all the major stakeholders and all these stakeholders. So that's from all the levels of government, from the ministry levels all the way to the community level. So we have Ghana Health Service, we have all the districts, we have district representatives, we have community representatives in the form of community health officers, Ghana Education Service, we have their regional directors, and as well as their district representatives. And the key thing about this part is to ensure a buy-in for the project and secure their buy-in. And so this planning meeting gave us a platform for all participants, including the Queen Mothers, who play a very critical role, to come in, discuss the project objectives, as well as come up with a way forward with regards to how the objectives are going to be met, what role each unit is going to play, and how they are going to play those roles. And we find that to be very, very important, because then it also ensures that these institutions claim some level of responsibility as well as ownership for the project. So moving on from that level, we made the government institutions responsible for selection of facilitators. So from the previous agreement, they have to select the right people who they think can help us achieve these objectives, the project objectives. And this, again, is very, very key to ensure that the project continues and then it will be sustainable and becomes a part of their normal regular activities that they undertake in their respective districts. Because with that collaboration, in order to have an effective collaboration, we need to get all of them engaged, and the engagement starts from the highest level all the way through to the community levels, and getting them to work together ensures that each person can hold each other accountable, as also support each other in performance of their duties.
Adolf, it's Susan here. You're breaking up a little bit. I'm wondering if we can't really hear you that well. I think the sound isn't working that well, actually, Adolf. You're breaking up a little bit, unfortunately. What I might do is I might make myself the presenter, and then I'll show your PowerPoint presentation through my screen, and then that way, and then you can still continue talking through, because at the moment you're cutting out quite a lot and we can't hear so much. Is that okay?
Sure, that's okay.
Okay, yeah, the sound is a bit clearer now actually, so that might be the thing to do if that's all right with you. Right,
okay.
I will. Thanks, Adolf. Sorry, the line was a little bit. I don't know if it's like a connectivity issue, but it was perfect on the practice run. Right. Okay, so where were we here? Yeah, please. Sorry, Adolf. Please continue.
Okay, so just continuing from the shared responsibility aspect and project ownership, we engage each stakeholder in a way that they would take full responsibility for every component of the project and at every point in time. Because one of the key challenges we face is government, especially, seeing the project as not theirs, one of their own projects, and so they can choose not to support, or their engagement, the level of support and engagement can be quite minimal. So what we give them those responsibilities, make them accountable, share timelines, as well as key objectives and what's expected in time. And, another thing that we identified and is very key to our work.
Sorry, Adolf, we've lost you again. I don't think the connectivity's worked that well. I think
we
Adolf,
do realize that there's some level of challenges when it comes to
possible for you to log out and log back in, because I think sorry, it's really breaking up and we can't really hear the presentation. So I think it might be worth you logging out and logging back in, and then to do the presentation again, because we think it might be the issue with the connectivity. Strange, because it was working perfectly for the practice, but I think it might be better if you log out and log back in, if that's okay. And in the meantime, whilst you're doing that, I might hand over to Kesi, who's arrived, and then he can do his presentation, and then we'll come back to you if that's okay, Adolf, because we're really not getting the sound. So if that's right, Adolf, if I ask you if you just come out, so if you just click exit and then come back in again with the same link, then we'll be able to hear you a little bit better. Hello, Adolf. Okay, so Adolf's gone offline for now, but we do have Kesi who is online. So sorry about that. Just somehow the connectivity wasn't working ideally, but hopefully we now have Kesi. Do we have you online now?
Yes, I'm here. Thank you.
Okay.
My connection is about a lot better than Adolf's was.
Yes.
I am sitting in the airport, and I hope the background noise is not too distracting.
Okay, that's fine. What we might do is I'll also click through the slides then, because that hopefully that might make a difference. Yeah, so let me, whilst Adolf is logging out and logging back in again, let me introduce Kesi Naidoo from Brian Holden Vision Institute, South Africa. So Kesi, over to you.
Hi, good afternoon, everybody. It's a pleasure to be with you this afternoon. I'm just going to talk briefly about some of our experiences and some suggestions from our experiences of working with governments, largely in South Africa, but also in other parts of Africa and the developing world. Moving on to the first slide there. I think one of the first things we need to look at is when we want to work with government is why. And I think our experience has shown that it's possible through working with government to be able to achieve much more sustainable solutions that will outlast the life cycle of a project, and it's basically your best buy. So, we all appreciate that it might not necessarily be the easiest thing to do, but in the long term, generally works out to be the best thing to do, in our experience. Looking at also what are the factors that influence government. There are global issues, global policy statements, global treaties that governments have signed up to, including the Vision 2020, the rights of the child, and all of those are important documents, important commitments that when we need to work with the government, use these as trigger points to energize our program activity and our particular projects. So it sits within policy or within global policy frameworks that the particular government is already committed to. So we're not bringing something to them, but we're helping or assisting them and supporting them to deliver on a commitment they've already made. Likewise, there's the local policy, the government policy at a national or a provincial or district or regional level. These are all factors, and once we identify all the relevant global or local policy issues, those help us to understand the local situation and derive from that local situation in developing our approach. We also can develop an advocacy plan, and the advocacy plan can have more than one approach. It could be advocacy towards a particular advocacy goal, but it could also be advocating using a demonstration model uh, to advocate for a particular change that we want to see in that particular government system. We will discuss that a little bit more detail in the example that comes up. If we go to the next slide, Susan. These are the values that we think are very important when working with not just government but all of our stakeholders. But a particular importance are our program work has to be founded on the tenets of human rights, respect, trust, and transparency. And quite often we find that you get governments become a little bit. There's this view that is often held that non-governmental organizations or NGOs are walking around with a lot of money that they get from funders, and governments don't really know how that money is spent. So it's very important in our dealings to ensure that we allow as much transparency, particularly around the financial components. Uh, Respect and trust flow from the fact that you're able to take people into your confidence and show them that your agenda is not about making a quick buck, but it's really about ensuring that they are able to deliver on the particular program activity that you are trying to assist them with. Next slide, please, Susan. So when you're looking at reviewing in the planning phase, as I alluded to earlier, you're looking at reviewing your relevant international and local policy, analyze the policy implementation to identify policy gaps or implementation challenges. The question you need to ask is, do you need to advocate for new policy or improved implementation? And here's where a demonstration approach can be useful. Then you actually analyze the local health and government structure. Who are the key decision makers and who holds influence over these individuals? This is very important because once you're able to identify who the key decision makers and who are the influences of those individuals, it enables you to develop a strategy in which to be able to convince these people that what you want is important for them and for their programs. Of course, the relationships you develop take time, and it's also developing a track record which creates trust. So, none of these things will happen overnight. Working with any government, you have to develop you find your feet, and it takes a few years at least to be really strong footing. Go to the next slide, please. So on the sustainability, we're firstly looking at ensuring your buy-in from the key leadership. This is at the outset, and that could come in the form of a formal agreement between your organization and the government. It could be the form of an MOU, a contract, a service level agreement, whatever is required in that particular step. But the important thing is that this agreement defines and describes the nature of your relationship. What are your responsibilities? What are the other parties' responsibilities and roles? And a very important component is this idea of ensuring that you do not support costs that are not necessary and are already in the budget. It's quite easy for people to try and make you to spend money to cover things that they would be spending anyway. And once you take away that responsibility, it's sometimes impossible for that responsibility to be taken up again. So you might just be doing more harm than good in the long run. And look at your building your support around the existing system. And your exit strategy must be clearly defined from the outset. There should be a gradual transition. And you also have to have a level of flexibility. It's often factors beyond the control of the particular managers you may be working with that might mean that something they promised you to do in 6 months might take them 18 months or 2 years. But as long as you're able to manage that situation, you have the flexibility, you can have good outcomes at the end of it. Next slide, please. Okay, briefly, just a quick case study. This is KwaZulu-Natal province in South Africa, population of 10 million, with 11 health districts, approximately 1 million people per health district. And this refers to a project that was funded by SiB, the Giving Side to KwaZulu-Natal project, between July 2007 to June 2011. Next slide, please. So the key issue on here was optometrists in the public sector. South Africa has always had a lot of optometrists trained and in the country, but very few of them working in the public sector. And it started, way back in 1998, that advocacy with the National Prevention of Blindness Committee to convince them to establish optometry within the public sector was started. But while this was met with some success, there were delays between the time when a graduate is ready to be employed and when the department could actually employ them, which meant that most often that on a graduating cycles, your graduates would wait maybe 1 or 2 months, and then because they're not able to get into the system, they would go on to other things, and then you would not be able to get them in again. Anyway, through the Seeing is Believing support, we were able to agree with the provincial and district and institutions that posts that will be created, which we will fund and support in the first 2 years. Those individual institutions will then establish those posts themselves over the next 2 years and assume the responsibilities. So we employ the optometrists, deploy them to these positions, and the institutions will then assume the responsibility over the next 2 years. As a result of this, we were able to increase the number of optometrists in the public sector in KwaZulu-Natal from a base of approximately 4 to 30. And currently there are over 60 optometrists in the public sector. So optometry in the public sector in KwaZulu-Natal now is well established, independent of any support from any external provider. All of those optometrists are employed by the Department of Health, working in Department of Health structures, and providing service on behalf of the department. Okay, thank you.
Thank you, Kesi, for that really interesting presentation. I love the fact that you spent some time at the beginning talking about the why. Why do we do this? It can be quite time consuming, quite challenging, lots of different barriers to working with government. But by really emphasising that at the beginning, you do help us all kind of focus on and this is why we do it, and a lovely example there at the end with the optometrist. So thank you so much for that. That was a wonderful presentation. Okay, and I am delighted to say we've got Adolf back online now. So I'm just going to I think Adolf, I think you've muted yourself. So if you can just unmute yourself. Should have you on there now. So Adolf, can we hear you now?
Yeah, sure.
Okay, great. Yeah, that does sound that you're a little bit clearer. So what I'll do is I'll just go back to, I think we've got to slide 2 or got past that one. Right, do it as full screen mode. Okay, I think we'd got onto the next slide actually, although we didn't hear so much. I think we just finished this one. So maybe if you can continue the presentation from key challenges, that would be wonderful. But thank you very much for persevering and coming back on. Hopefully the line will be a little bit clearer now. So thanks for sort of rejoining us.
All right. Thanks everyone, and sorry for the challenges with network. But so moving on, I want to touch on some of the key challenges that we face and what we continue to face working with government. And as with every government institution, we have a lot of bureaucracy to deal with, which extends to, which results in a long lead time. So sometimes there leads to a slow pace of our activities when, even though we have key objectives and then timelines set for everyone else. The process is just very slow, and there isn't very much that we can do with regards to going around the going through the government bureaucracy system. And then another key challenge that we face is prioritization of our project, because as it is, our project is quite small when you compare it to other projects. So one of our main challenges that we face is getting government to give us the right amount of right allocation of resources as well as time, and it's always very difficult getting that done. And also with a smaller project, they would want more control, and that is one thing that we are not able. We can't let that happen now. So we can't give government so much control into the running of the project. So that also leads to them really showing a little bit of not prioritizing our project with the right amount of urgency that we need. And that's also one of the challenges that we face quite often. And then another challenge is information sharing. Throughout the government structure, there is a lack of a formal information sharing structure, and this goes a long way to affect the way we interact with government. So in all cases, information transfer has been one way. It comes from us to government, but we don't get a lot of feedback from the government institutions. For instance, there is not a very easy flow of data from between the two of us. So we are the ones who are helping drive that. And also that provides us with some opportunities for some level of system strengthening. Then another thing is maintaining project relevance, which is also one thing that we always have to deal with, because obviously our project being smaller, and then also eye health being an area, a sector in the healthcare system in Ghana, which hasn't seen a lot of development over the past. And so we have to do a lot more to show that, yes, our project is impactful, it's very necessary, and requires the right amount of resources as well as time from the government and all various key stakeholders. Next slide, please. Okay, so with the identification of these challenges comes with our approach to dealing with them. And as I stated earlier, it's been very key for us to come to an agreement with all the key stakeholders on deadlines. So all our deadlines, we set very clear deadlines with them, and we agree with them that each party involved in the project is responsible for achieving various items as well as key activities, and they are supposed to deliver it, obviously with support from each all the other participating institutions. And with these, for a while, we see that is helping because that makes them feel and take up some ownership, some level of ownership for the project, because it depends on these government institutions to deliver, and that affects them in the long run if they are not able to deliver, and also goes as a feather in their cups if they are able to deliver and then meet these deadlines as well as meet their responsibilities. And then another key thing is also trying to, with the absence of information sharing structures, is building and then working with a structure of information sharing, which which in a way helps to maintain the project relevance. And so we constantly share information with our partner institutions to let them give their periodic updates. We get their feedback, as well as also identify various opportunities as well as areas of challenges that we need to address and then work with. This has also been quite helpful, even though in an absence of a fully functioning formal information structure, we are currently working with the government to have include eye health indicators in the health information management software, which we have gone far at this point to ensuring that that's possible, and that would go a very long way to ensure that information flow is very easy, as well as also ensure that there will be data and relevant information at all times available to all key stakeholders, as well as the healthcare system strengthening on the whole. And then one of the things that we also do, which is very, very important and has I believe is perhaps one of our best things, is having dedicated forum for a project review quarterly, where all the participating districts and institutions meet to deliberate. And it's sort of a platform for a friendly competition where each district shows how well they have performed with the resources that has been allocated to them, as well as also share some of their ideas. It's really a platform for exchange of ideas on ways to strengthen the system, identify areas of challenge, and then also find ways forward. And each district learns from each other. And so there is always that need for districts to show they are performing very well. And once they perform well, it also goes a long way to enhance their image overall in the National Healthcare Assessment Program. And so with this level of accountability, it goes a long way to ensure the project, the integration process speeds up, as well as necessary buy-in from the districts, because they have to ensure that they are doing very well with their resources, and especially with comparison to other districts who are participating. And then also, I would also like to talk about reaffirmation of commitment by officials. You know, even though we have agreement with the and various offices, it's also very important to secure the commitment and buy-ins of the individuals who hold those key offices. Because how we tend to do this is usually through regular courtesy calls, as well as updates, giving periodic updates on projects, seeking their opinions, and then also getting them to directly intervene in areas where their direct interventions are required. This has gone a very long way to ensure that we maintain a very good working relationship with various government officials, because at every point in time, they are very well informed of our activities, as well as know which that information also goes a long way to know how well they can support. It helps them to determine the right level of support for us, and also take us through the right processes. And that has, in a way, also helped with dealing with some of the challenges with bureaucracy. Next slide. And I must mention that perhaps our best and key strategy is knowing and understanding existing structures and working with those structures. With these government institutions, they usually have structures that they're already functioning in, and that works for them. So it's very key for any new project to quickly adapt to these structures and work with them within these structures. These structures, working within these structures, provide us with some unique opportunities, not just for us, but also for the government system itself. Because one, by working with them, we are able to identify challenges in which we have to overcome. And by overcoming these challenges, we end up strengthening these existing systems and the structures, which not just helps with eye care, but also helps with the overall service delivery within the health sector. And then also by providing necessary support, and which goes in a long way to strengthen the system, we end up enhancing the relevance and then maintaining the project relevance. So for instance, currently we have supported the rollout of eye indicators in the health information management system. And though there would be it only involves eye indicators, the rollout also includes a portion of training for officials who handle the database on how to effectively engage and interact with the database. And so though it has helped our cause, it is also helping to enhance their capacity to work. And so these are some of the things that we do to really engage with government and also ensure that the project integration and sustainability can be achieved. Right. So thank you.
Thank you, Adolf. That was a really interesting presentation again. I love the idea about the forum and having the competition between the different districts. I think that's a really smart idea. And then also your key point about understanding those structures and then working within the existing structures is a really valuable point too. So thank you so much, and thanks for coming back in and being able to finish your presentation. I think that was really valuable. Okay, so now we're going to do the question and answer session. So audience, it's really over to you now. We've already had a couple of questions come through. I'm just going to say to you, if you don't know where your question, how to sort of send the question, if you have a look on your GoToWebinar sort of main pane, there should be sort of an orange rectangle with a white arrow on. If you click on that, then what you can do is you can go down to either chat or questions, and you can put in your questions. Some people have already introduced themselves, which is lovely, to the group, and then that's really the place to go to put your questions. So I think what we'll do is I'll ask the couple of questions that we've already started, but then please do, if you've got some questions that you are really interested in, or there are specific areas that you would like our panelists to talk a little bit more about, please do send us your questions and I will answer them. And if you do have a question, please do just feel bold to send us your questions, because if you wait too long, then we'll run out of time and you won't get to ask your questions. So do ask your question. So I'm starting off a couple from Patson Tembo. So hi, Patson. So his question, and I'll ask to all three actually. So Glenda, I'll also be great to get your feedback as well. And we'll go through the same order if we go for Glenda, Adolf and Kesi to answer the questions. So Patson's question is around, the project has a life cycle. Major problems can arise when the implementing partners exit the project area and then the intervention does not continue to benefit the targeted people. So what plans are you putting in place together with the government to avoid this problem when projects leave particular areas? So it's almost like the kind of closing out of projects and the sort of long-term sustainability. How do you sort of ensure that, you know, the systems you're supporting doesn't just sort of disappear once, you know, seeing as believing funds stop and you know, the project leaves? And a second question, which is around, how do we integrate the projects into existing government structures? So Glenda, I'm just going to unmute you, and if you'd like to give us some of your thoughts on those questions. Oh, I think maybe you've self-muted, so you can just unmute yourself. yeah, that's it.
Okay. Thank you, Patson, for that question. I think what we need to do is really to build into the projects from the onset in terms of the sustainability. Because if we're not working closely with government, if we're not working closely with other stakeholders like civil society, obviously we'll have this problem where when the project leaves and then everything just shuts down. That doesn't mean that we lost everything. Obviously, we were providing a service, we're preventing blindness. But I think what's also key is that we build into the sustainability plan the issues of capacity building at the different levels of government. We build into the plans the issue of government also contributing, putting certain resources towards eye health, not just at national level, but also at the district levels where we work and the local levels. That will go towards supporting the human resource, but also to go towards the purchase of the usual consumables. So the consumables that should be purchased for eye health should be the consumables that are also going into other programs, like a regular wider health program. I think that would be important from the onset. And also in terms of human resources, I think once we advocate with government in terms of the importance of human resource for eye health, in terms of we use evidence in terms of statistics coming out of communities where we're working, of how many people might be at risk of going blind from different conditions. I think this would actually help in terms of government putting in place a human resource that will actually stay in the areas where we've been working and ensure that there's capacity building, there's human resource. They're also funding for normal consumables, normal eye health drugs that are going into the kit that is going at district level, at community level. And I think that is at this point, I think that's what I would say from the beginning. It has to be built into the plan. We can't start thinking at the end of the project, okay, what are we going to do about human resource? What are we going to do about drugs? What are we going to do about equipment? What are we going to do about everything else? It has to be from the onset so that we know what the gaps are within government, within the different layers. And in the lifespan of the project, we try to address those gaps and narrow them down so that even as we are living, these gaps are narrowed down and we're able to continue to offer some services at community level.
Thanks, Glenda. Yeah, no, that's really important. I think having those agreements up front and getting people engaged the whole way through, working out actually which bits are the project would be covering and which bits the government would be. Absolutely, thanks, Glenda. And then Adolf, same question.
Yeah, thanks for that question. So during my presentation, I really emphasized on the need to engage with existing structures. And from my experience here, we realized that immediately, right from the onset, once you secure their buy-ins and then work within the existing structures, it becomes part of their routine activities. And we also engage on all levels, because it's very key to engage from the policy level all the way down to the implementation level. And so on the policy level, we are really strengthening the system for them to have the information necessary for them, the data necessary for them to make the right levels of policies. And then on the implementation level, we are equipping the primary caregivers with the necessary skills to handle eye health cases, because in most of the districts, all the districts you're working in, the primary caregivers have no training in eye health. But with that training, they will be able to deal and address any eye health conditions that come to them. So even once the project runs out, the expectation is that these are skills that these people possess that they can use regardless of whether it's for the duration of the project. And they would also provide information that would feed through the existing structures all the way to the end, because they submit monthly reports. And with that reports, now that they have been trained and they have the skills to deal with eye conditions, they would provide information on eye conditions that they have seen. And this goes all the way through the system and the structures all the way to the top. So really, at the end of the day, the top makes decisions based on information that comes from the lowest levels, and eye health issues become part of the information that comes up routinely. And so that is really the key things that we are working with, is really engaging on all levels and then also developing capacities from from all levels as well. Thank you.
Absolutely, thanks, Adolf, and that's so important in terms of finding out what those systems are, because one of the things that came across in your presentation was that actually taking the time to find out who are the people that you need to be influencing and what is the existing structure, and then you can then go ahead at working out your strategy of influencing them. So that's great, thank you so much. And then Kesi, finally over to you on these questions around how do you avoid there sort of being a sort of vacuum almost once the project's finished and integrate within the existing structures?
Thanks for that. I think my two colleagues have given quite a lot of information, and all of those are very valid points that have been brought up. What I would like to add is that it might be important in developing your project is to develop within the structures, within the systems, advocacy agents for yourself. So, may they be nurses or optometrists or whatever, within the lifespan of the project is to develop them so that even when you find yourself in a situation where the project life cycle is over, the department of the government is not taking over things, you can have these people continuing to agitate from within to be able to deliver the change you want to see. The other approach, of course, is to have some kind of a contingency or a backup plan where you might be able to deliver services at a lower level for a short while. But all of these things, you need to be careful that you don't just create a culture of dependency. Another factor I think is also when identifying partners and governments that you want to work with. If you look at the track record of a particular health district or a particular country, and they always have new NGOs coming in, working with them, and then they move on, and you get another NGO coming to do the same thing. Sometimes it might tell you that, listen, these guys are not really taking this as seriously, and they're really looking for NGOs to support the IL component for time immemorial. And you need to make a decision up front whether you're really going to support a program. Those would be my additional.
Great, thank you. And I really like the idea about finding out the people within the system who are really passionate, and just giving them that little bit of a push, then they will continue to be advocates even once projects are finished and continue to be passionate about the work. So I think that's a really important one. And also, yes, it's do the background of the history, what's happened within that particular region is really important too. So thank you for that. Okay, we've got a few more questions coming through. So please do, if you do want a question, please do pop it in the chat box or the questions section. And I've got a question here from Alice Mwangi from Kenya, and she's saying, she's asking, how do you keep government staff motivated, as well as how do you manage staff expectations? So this is something that does come up from time to time. How do you keep people motivated within to do the work that you want them to do? So again, we'll go the same order. If we start with Glenda, then Adolf, then Kesi.
Thank you. I think it's not just money that we have to think about when you're thinking about motivating government staff. I think there are a few other things that we can include in the programs, like training, exchange visits, in terms of if there's one of the teams in an area who are doing very well, you can organize an exchange visit. You can organize train people from one region to another to go and do training for communities from another region. Just different things that can actually keep them motivated, but also building their capacity so that in the long run they're still able to provide a good service on the ground. Because if we just focus on the money, it is something that is not sustainable, something that might not actually help us in the long run. So just training, just capacity building, some exchange visits, all those can actually motivate Ministry of Health staff or government staff.
Absolutely, yeah, no, that building of capacity is something that they can kind of take with them as well into the future. So thank you, Glenda. Okay, Adolf, over to you.
Yeah, thanks for that point, Glenda. Really, for motivation, it shouldn't be monetary. My experience here is that we I noticed that most of the people that we work with in government, they are always interested in getting some professional development. And so for instance, the primary caregivers, they get to acquire new skills, which they're always very excited about to acquire, because then they can expand it. Their ability to work has been expanded, and that is always good motivation. So we always have people interested in participating in our projects. And then also with other government officials, obviously, yes, of course, they get to learn. For them to, we expose them to new things and new ways of thinking that enhances their work. And again, for instance, the system that we interact with, there is always continued development and then improvement of that system. And so that system strengthening goes a long way to motivate them, because then they learn new ways of doing things within the same existing structures, or they have solutions to some of the challenges that they've had in their current systems. And so really, these are just a couple of the things that we do here to maintain their motivation. Yeah, thanks.
Absolutely. And actually, it's just made me think when you talk about your primary healthcare workers, I think it was when the sound went a little bit in your presentation, but your project specifically works with the Queen Mothers within the communities. Do you want to just explain a little bit more about what their role is and what they do in the communities and in part of the project?
So the Queen Mothers, they are considered as very key opinion leaders, and with the goal of the project really getting down and reaching community members, the Queen Mothers act as a very key advocacy mouthpiece in community mobilization, as well as also ensuring, to some extent, some level of compliance, because they can get us access into the communities, and also they can advocate, especially for caregivers, primary caregivers who happen to be women. They look up to these Queen Mothers as their role models. And by looking up to them, these Queen Mothers also give us that opportunity to interact with the community members, as well as also the primary caregivers. The Queen Mothers point these community members to the primary caregivers who have received some level of training. And so that interaction doesn't break between the Queen Mothers serve as the link between the community members and primary caregivers, and then on the whole, generally, as the link between community and then access to healthcare. Thanks.
Great, thanks for clarifying. It's a really innovative idea, I think, from this project, which I think is really interesting for other people to hear about it as well. So thanks for that, Adolf. Okay, and then Kesi, the same question to you about how do you motivate, how do you keep government staff motivated in your projects?
I think there's been some good suggestions, and there's good ideas that have been presented thus far. My additional would be to think about, perhaps having some kind of competitions, some ways, just to ensure that people firstly get acknowledged for the good work that they do, and secondly, a little bit of competition, a small trophy and a small gift goes a long way towards motivation as well, in our experience. But bearing in mind that also you don't want to establish something that is not going to be sustained. So you might want to think about it. If you do set up a competition, for example, an inter-district cataract surgery rate competition, it might be something that you invest in even slightly beyond the life cycle of your project, just to ensure that it has some benefit.
Yes, thank you. And it's important to consider all of those issues in the round, so rather than just thinking about how do we do this now, but how do we do this now, and then how will it be into the future as well. So thank you for that. Okay, I think we're coming to the end of our question and answer session, but I might just finish just with one question, which has come from James Avery. Which is, how would you best measure successful government engagement? So what would it mean to you, and how would you best measure it? So we'll call that our final question. So again, Glenda, we'll start with you, and then Adolf and Kesi, and then we'll go to Sally for the roundup.
Oh, wow. That's a trick when measuring successful engagement with government.
Yeah.
I think when we look at the programs and we look at how they're being managed and how we look at the commitment and the ownership, I think that would be one of the ways that we can measure successful engagement with government, because if they're really engaged, then they'll be on top of things, they'll be in control in terms of what is happening, they'll be making decisions that are good for the project, they'll be ensuring that we're actually delivering according to the objectives of the project. So I think it's we can measure that through commitment, through how government is actually integrating eye health within the wider health systems, how they're even allocating resources towards eye health. I think those are some of the things that maybe we can look at in terms of just measuring successful engagement with government on eye health.
Yeah, absolutely. And I'm just thinking back to one of our previous Singers Believing webinars where we were talking about, getting eye health drugs on the essential list, that kind of thing, getting that budgetary commitment from the government as well. So thank you, Glenda, for that. Okay, Adolf.
Yes, that's quite a bit of a tricky question, as Glenda stated, because really to look at the engagement and measure the success, I would look at the objectives that we begin with, and then how much responsibility and ownership government has taken, and also the extent of integration, how fast that has been, even though yes, they would work with us to some extent, but the commitment they show to ensuring that it becomes part of our part of their structures, and then also becomes a policy or something they work with at all times. And also, if you can also look at the advocacy aspect of it, where we do some fair amount of advocacy, and we want to see how responsive the government has been to our to some of the topics that we have advocated on, for instance, including eye health indicators on national data sets, and then the system, getting national health insurance to cover various eye conditions, as well as also including essential eye commodities on the health insurance list. And so when you have to look at all of these things and see how far you've gone, and then how within the period of time, that could serve as some indication of how well we have engaged government. Yeah.
Thank you, and I think that's a really good point to bring out, the getting the eye health indicators on their HMIS as well, because if people aren't recording something, then no one really knows, you don't know if it's happening. So, and then using that data for your advocacy, that's a great point. Thanks so much for bringing that up, Adolf. Okay, and then finally, Kesi.
I think the one thing that will be important is, if you're going to measure our government on something, is to perhaps agree up front on what are the measurements, what are you measuring. So at the outset, you mutually agree what are the factors you want, what you would like to see, and at the end of it, you are able to measure against those, and it's a very clear and transparent process. That would be my take on that. Thank you. Sorry, Susan, I do need to run off. I have a flight to catch, so I must apologize.
No problem. We've come to the end. Thank you so much, Kesi, for being able to fit us in your massively busy schedule. So no, please run and get your flight, and I'm going to hand over to Sally now anyway. But Kesi, thank you so much for your presentation, and we wish you well and a safe flight. Thanks, Kesi.
Thank
Bye.
You. Bye.
So for the rest of us, thank you so much for your questions. I'm sorry I wasn't able to ask all of them, because it was great to see that so many of you wanted to engage. If you have a question and you feel it wasn't answered, or you wanted to ask something, then you can just email me afterwards, and I can forward your question to the relevant presenter if there's any further information you need. But finally, I would like to introduce Sally Crook, the Seeing as Believing Programme Manager for IAPB, for some concluding remarks. So Sally, over to you.
Okay, hello everybody, and many thanks to our three presenters, to Glenda, Adolf and Kesi. I've really enjoyed these presentations, and I'm learned a lot in the reflections of how we work with governments. And I think in the interest of time, I'm just going to focus on a really couple of issues. And that was that several of the presentations, they sort of mentioned that at the moment there's a lack of focus on eye health, or that it's a small priority in the sort of bigger picture of what the Ministry of Health or the Ministry of Education has also got to worry about and things. And so how do we get this focus, and also how do we then ensure that they maintain this new focus on eye health and service delivery? And then the so that's a sort of a major challenge for all of you in all your countries across Africa. And then the sort of from the two presentations from Adolf and Kesi, what I got was it's this issue of you do have to focus on the system and you know, the wider picture of where does eye health fit in for the government. But then there was a lot of discussion about, you know, how do you work with key individuals, those key decision makers who are going to make things happen and get change. And like in answer to some of those last questions, just how do you get eye health included on the HMIS, or, you know, how do you get eye health services mentioned in the insurance policies? How do you get items on the, you know, essential drug list and things? You know, you need to work at both levels. You need to be very focused on the sort of the landscape in which you're working, but then you also need to find these key decision makers and work out how you're going to influence them, how you're going to build up relationships. And again, a point that came out from all three presenters was this all takes time, and that you need to be very structured about it and very clear. And I do think that this point of you need to have an exit strategy right from the beginning, from when you start to engage at the, you know, no national, provincial, and maybe hospital level. If you're working with a tertiary hospital, you really need to be clear what the project is going to do, but what you expect the government to do, and how you see the future looking once the project comes to an end, and what will the government be expected to take forward. Because if we're raising expectations in the local community, somebody has then got to meet those needs as people continue to come forward with their eye care problems. But I mean, a great three presentations, and I think we've learned a lot today, and maybe given ourselves a bit of food for thought as to how we can continue to work with governments and really get some long-term solutions to a lot of the needs that are out there. Anyway, thank you to everybody. Thanks.
Thanks, Sally, for that summary of the presentations and bringing out some of those key points. Was really interesting. Thank you. Okay, so I would like to end today by thanking all of our presenters, Glenda, Adolf, Kesi and Sally, for their comprehensive presentations and responses to all of our suggestions. I'm just going to mute. Yeah. And thank you, Emma, for all the technical support as well, particularly for bringing Adolf back online. So that was really great. I'm glad that that was able to happen. And thank you to everyone who's participated. Really appreciate you all taking the time to be part of our Seeing is Believing learning community. And I have just one final favour. I'm now going to email all of you the Seeing is Believing webinar survey, and please take just 5 minutes to complete it, as your support for these webinars makes them possible and your feedback helps us to improve them. So thanks again, and I look forward to seeing you all at future Seeing is Believing webinars.
Okay, thanks,
everyone.
Susan.
Thank you, Susan.